Welcome to the Center for Joint Replacement for your post-operative aftercare instructions. Thank you for choosing to have your joint replaced at Ridgeview Medical Center. Please follow along in your guidebook as we discuss this important information. Please turn to the pain management section in your guidebook. What techniques can you use to manage pain besides medication? Get up and ambulate. Don't sit in one position for a long period of time. Change positions often. Move every hour. Resting is part of recovery. Make sure you are taking time to rest, especially after exercises. Ice can be used at any time to decrease inflammation and swelling. It is most important to use ice after exercises. Don't place the ice directly on your skin and check the area for excess redness. You will need to elevate any time you are sitting for an extended period of time. You can use a stool when eating at the table. Elevate your legs above heart level 20 minutes twice daily after exercises. How can you manage constipation at home? Lack of activity and narcotic use can cause constipation. If you have constipation as a baseline, you will need to follow your normal regimen and add stool softeners or laxatives. You will need to use over-the-counter stool softeners such as Colace or Senecot as long as you are taking narcotic pain medication. Increase your fiber slowly and your fluid intake. Refill your water pitcher 3 to 4 times throughout the day. Increase fiber with prunes, veggies, Metamucil, or Benefiber. Don't go longer than 3 days without having a bowel movement, or if you stop passing gas, become bloated or nauseous, you may need to use an over-the-counter laxative, suppository, or an enema. These can be purchased at any pharmacy. Temporarily stop stool softeners if you develop diarrhea. How do you get your narcotic prescription filled? A prescription will be provided at discharge. Narcotic prescriptions cannot be called into a pharmacy, and prescriptions will not be given after normal clinic hours or on the weekends. Please plan ahead. Call your surgeon's office by Thursday if you need more medication. What is the generic name for Tylenol and what is the abbreviation used on the prescription? The generic name for Tylenol is acetaminophen. The abbreviation is APAP or APAP. Your narcotic prescription may contain Tylenol if you are taking Norco, which is hydrocodone and Tylenol, or Percocet, which is oxycodone and Tylenol. Each tablet contains 325 milligrams of Tylenol. What is the maximum Tylenol dosage in a 24-hour period? The maximum dosage is 3,000 to 4,000 milligrams in a 24-hour period. Keep track of how many milligrams of acetaminophen you are taking by using the chart in your guidebook. Also check the amount of acetaminophen in any over-the-counter medications such as Dayquil, Alka-Seltzer, or Excedrin. Please turn to the blood clot prevention section in your guidebook. What are the signs and symptoms of a blood clot in your leg, also called a deep vein thrombosis or a DVT? A DVT can be located in either leg. It does not necessarily have to be in your surgical leg. There can be increased pain and swelling that does not go away with rest, ice, or elevation. It can be hot to touch or red. There can also be tenderness in your calf, back of the knee, groin area, or entire leg. What are the signs and symptoms of a blood clot in your lungs, which is also called a pulmonary embolism or a PE? A pulmonary embolism can develop if you have a blood clot in your leg that breaks off and travels to your lungs. A pulmonary embolism is a 911 emergency. Signs and symptoms of a pulmonary embolism are difficult or rapid breathing, shortness of breath, chest pain, sweating, or confusion. Please keep in mind that sweating or confusion can be a side effect of taking narcotic pain medication. What can you do to reduce the risk of getting a blood clot? Do your foot and ankle pumps 20 times an hour while sitting. Be active and don't sit in one spot for a long period of time. Wear your compression stockings. Take them off for 1 hour in the morning and 1 hour in the evening. And if you need to wash them, you can hand wash them or put them in a garment bag. Place them over a line to dry. Don't put them in the dryer. Your surgeon will determine when you can stop wearing your compression stockings. Every patient that has had a joint replacement surgery will be on some type of blood thinning medication for a short time. Medications such as aspirin, warfarin, or Xarelto may be used. Your surgeon will determine what is best for you. Please turn to the infection prevention section in your guidebook. How frequently should you be changing your dressing? You will change your dressing every other day unless there is drainage bigger than a quarter. If you need to change your dressing more than 2 times a day, you will need to contact your surgeon. Change your dressing after a shower. Do not soak your incision in any water. No hot tubs, bathtubs, swimming pools, or lakes. Your nurse will teach you and your coach the dressing change prior to discharge. What are the signs and symptoms of an infection? Increased swelling and redness around the joint. Change in color, odor, or amount of drainage. There can be increased pain. Skin around your surgical site can become hot to touch. It is normal for that skin to be pink and warm. If you develop a temperature greater than 101 degrees with or without chills, please call your doctor to rule out an infection. What can you do to reduce the risk of getting an infection? Take proper care of your incision. Follow our guidelines for keeping your dressing clean and dry. Wash your hands before you change your dressing, and wash and care for cuts anywhere on your body using an antibiotic soap or an ointment. What should you do before any future dental work, including a regular cleaning? You will need to take an antibiotic before any dental work, even a simple cleaning. Anytime there is blood involved, bacteria can enter into your bloodstream. Your surgeon will talk with you about getting your prescription filled. Follow your surgeon's recommendation on the use of antibiotics prior to any dental work or cleaning. If you have any questions, always refer back to your surgeon. No dental work for 3 months after surgery. Twin Cities Orthopedics has an orthopedic urgent care. They are open from 8 a.m. to 8 p.m. 7 days a week. Please refer to the Twin Cities Orthopedics website for a list of current locations or talk with your nurse for a location nearest you. Thank you for choosing the Center for Joint Replacement at Ridgeview Medical Center. We hope you have a great recovery.